Hi everyone, let's see about jaundice evaluation. So this is the anatomy of the liver where you see many hepatocytes and then you see a bile duct here, and from the bile duct you have the bile canaliculi which goes in between the hepatocytes. Hepatocyte is the place where ALT and AST are produced, and bile canaliculi is the place where ALP is produced. So AST, ALTs are produced when there is a hepatocellular injury, and if the AST is more than ALT, it's alcoholic hepatitis, and vice versa. If the ALT is more, it's viral hepatitis. Okay? And AST will also be more in advanced cirrhosis and muscle injury. And SGPT is also called as ALT. And SGOT is called as AST. So this is the differentiation of few kinds of jaundice based on SGOT and PT. In intrahepatic hepatitis, there, for example, in cirrhosis, early stages, OTPT will be mildly elevated because there is ongoing hepatocyte injury which releases these enzymes into the blood. But whereas in advanced stage, the hepatocyte is already destroyed, so there is no OTPT available. So either it's normal or low. Another kind of intrahepatic jaundice is viral hepatitis, where you will have an OTPT of around 500 to 2000. Whereas in ischemic hepatitis, which is also intrahepatic hepatitis, the low OTPT will be more than 3000. And obstructive jaundice will have a normal or a mild increase in OTPT. So if the problem is inside the liver, the OTPTs are elevated because there is injury to the hepatocyte. Whereas if it's obstructive, the problem is outside the liver, post-hepatic. So OTPT is only mildly elevated. And in ischemic hepatitis, because of hypotension, LDH will be high. So, what are all the causes of prehepatitis? That is above the liver. If there is a problem which leads to jaundice, it's prehepatic jaundice. And the causes are hemolytic anemia, which could be seen in malaria. And obviously, conjugation happens only in the liver. So, unconjugated bilirubin will be high in prehepatic. And in prehepatic, there is no problem in the hepatocytes or the bile canaliculi. So the ALP and OTPT are normal. But sometimes OTPT can be mildly elevated.